Good day to all of my viewers. Today we'll discuss how to face a positive HIV report. I often see in my clinical practice that this is the most difficult situation somebody faces in their life when they are confronted with a report which is HIV positive. I had previously in my previous podcast told you about the actual what do you mean by a positive report. When all the three antibody tests come positive and that too in an ICTC center, then you can say it is a positive HIV report. So the first thing one has to do on facing this is have an attitude which is important. So don't panic. First consult your good counselor or your physician. Don't take any decisions on the spot basing on that report which is still to be interpreted. So there are many things in this classically described. First is counseling, second is confidentiality, the third thing is correctness of the report, and the last one is the co-infections. So the first and foremost thing I want to tell all my viewers is the counselor will first read the report and then the implications of a positivity will be told by the counselor or your physician based on their experience and their knowledge and their wisdom. So the most important thing here is to understand that there is life after a positive HIV report. It is not the end of life or it is not a death sentence. Because of after the advent of antiretroviral therapy, the viral load with a good treatment, triple drug therapy, is almost indistinguishable after a few months. Remember that this is the most important thing the science and technology has made to the life of millions of patients living with HIV/AIDS. So the first thing is to understand what your counselor is talking about this particular report with a calm mind and not to come to any judgment. And also remember that being HIV positive is not a crime you have committed or whatever you have done as a consequence of that. You will be accepted as it is by your counselor or your physician. Acceptance and being with a non-judgmental attitude. Once that is done and you know that you are not being questioned for what you have supposedly done to get this positivity, then you try to understand the implications of this report and the counselor will explain you or the physician will explain you the different ART options. So you have got either the option of going to an ICTC center where your confidentiality will be maintained, or you consult your own personal physician well equipped to treat your HIV positivity. Whatever it may be, once the confidentiality and the confidence you have gained with your counselor, then it is the counselor's job to make you understand that the treatment has to be adhered to lifelong. You have to take this treatment lifelong, and by taking this treatment, your quality of life will improve. You can continue your employment. That is the most important thing, and be accepted in the society like anybody else. So the confidentiality will be maintained and there will not be any stigma or discrimination. This is the most crucial thing, that is acceptance, confidentiality, and bringing a relation between you and your counselor or your physician. Once you understand the importance of drug adherence and taking the drug every day throughout your lifetime, the second most important thing is to take care of your nutrition. Please understand that your immunological status depends on the nutrition you take. So if you take a good high protein diet, at least practically speaking, high protein diet means taking eggs, 2 or 3 eggs every day, boiled eggs, or in the vegetarian options, there are various vegetarian options, that is pulses, various pulses where you can take or soya bean, which is a good protein option, and that will improve your immunity. And nextly, the most important thing is to consult your physician every couple of months to check either your CD4 count or your viral load to make you understand that the treatment is getting successful. So once you understand all these aspects, that is importance of drug adherence, consistency, having a positive attitude towards the treatment, doing your job or your occupation without any hindrance, adhering to the drugs and getting your nutritional status improved by taking good high protein diet, definitely you will be a different person. And I know in my 25 years of experience, patients are still on ART. After 2 decades, they are leading a normal life. So this is the most important thing to be understood by you, and not to panic and not to come to any hasty conclusions. The second thing I want to tell you today is that suppose your partner is also HIV positive, she is also taking ART drugs, still there is a possibility of viral load being exchanged between the partners. So condom adherence should be done, very important. And in the scenario of your partner being negative, now latest there is something called a pre-exposure prophylaxis, where your partner can take antiretroviral drugs and make their viral load indistinguishable and have a normal relation with you based on this scientific data. So with this pre-exposure prophylactic drugs which have come now, you can take a daily drug, or now there is an injection which has come every 6 months. So this is the latest scientific advances, where even if the other partner is negative, you can lead a normal life. And also now I want to tell you about my experiences regarding the PPTCT. So if antenatal mother is found positive with a good ART drugs and good ART adherence, the unborn child can also become negative. So the HIV is not passed on to the next generation. We have treated some thousands of patients who are HIV positive and who are having normal children without any HIV. This is called prevention of parent to child transmission through the use of antiretroviral drugs and proper delivery techniques during the time of delivery. So this in brief is about how to face a HIV positive report. So please adhere to this, and if still anybody has got any doubts, you are free to consult me on the link given below. Thank you.